to Z of diabetes. As we are heading towards the end of our second session of A to Z series of diabetes, a very warm welcome to you all, and especially our honorable panelist. I emphasize on very warm welcome as not only because summer is approaching, but V for very and W for warm, which are the next two letters of our today's presentation in A to Z of diabetes. On a lighter note, let me move ahead. While the first part of a presentation will talk about inadequacy, the second part emphasizes on troubles of abundance, which is weight, meaning V would represent, letter V would represent vitamin deficiency in diabetes, and letter W would represent weight management in diabetes. In today's session, letter V would be covered by dietitian Suparna Mondal. She is a dietitian working at Danone Nutrition, Kolkata. She would be talking about relationship between vitamin deficiency and diabetes. We at Day try to give an opportunity to young dietitians along with our senior and renowned dietitians on the same platform to show their talent. She is a MSc in dietetics and community nutrition management. She holds a diploma in dietetics. She is a certified diabetic educator. To her credit, she has a certificate in MNT, and she is presently working as a dietitian at Danone Nutrition in Kolkata. She had been working as a pediatric nutritionist at Digestive Surgery Clinic. She was a dietitian at BLCC, and she has worked as a trainee dietitian at ILS Hospital and Park Clinic Nursing Home. She's associated with organizations like Day and SND, Society of Nutrition and Dietetics. I welcome you, Suparna, and I'm handing over the session to you to talk about your topic. Welcome, Suparna.
Thank you very much, Dee. Should I start sharing the screen?
Yes, you can.
So thank you for beautifully introducing me. And thank you, Dee, for inviting me for such a beautiful program. So today I will discuss about the vitamin deficiencies in diabetes mellitus. Diabetes mellitus is a multifunctional disease, multifactorial disease that is typically linked to the energy metabolism and particularly the carbohydrate and fat management in our body. Most micronutrients are involved in either ways of the metabolism of either protein, carbohydrate, fat, or all. In diabetes mellitus, the carbohydrate and fat metabolisms are impaired. Due to that, oxidative stress is generated and the vitamins which acts as antioxidants, they are being used to reduce the oxidative stress in our body. In that way, vitamin A, C, and E, these three antioxidant vitamins are found to be decreased in diabetic subjects, possibly due to an increase in need to the control to excessive oxidative stress in these subjects. More studies shows that plasma vitamin C concentration has been inversely related to glycosylated hemoglobin or HbA1c level and fasting and postprandial blood glucose, but not related much to the lipid profiles. In type 2 diabetes mellitus or type 1 diabetes mellitus, in both cases, folic acid and vitamin B12 concentration in the blood has been found to be decreased. Maybe due to the oxidative stress, vitamin B12 and folic acid are being used to reduce the stress. Vitamin B12 deficiency is not common in general population until or unless they are on strict vegetarian diet. As the as vitamin B12 or cobalamin is present in mostly the animal food products, until or unless a person goes vegan or vegetarian, the person gets ample amount of vitamin B12 through their diet. But for diabetic patients, metformin is a first line drug to control the diabetes, particularly in type 2 diabetes mellitus. In that case, this drug interferes in the gut with the absorption of vitamin B12. This might lead to vitamin B12 deficiency. And vitamin B12 and folic acid, both deficiencies can lead to hyperhomocystinemia in our blood. Low dietary supplement, alcoholism, certain diseases of the digestive tract like celiac disease or IBS or any ulcerative colitis, pregnancy, and certain drugs like metformin or any other may lead to folate deficiency, that is vitamin B9 deficiency. Folate deficiency affects our body in two ways. One is autoimmune destruction of the pancreatic beta cell that can lead to type 1 diabetes mellitus. And another one is it can increase the insulin resistance and abnormal glucose metabolism in that way. That leads to the type 2 diabetes. Here are some foods which are rich in folic acid like fruits, bananas, legumes are very good source, eggs, asparagus, citrus fruits, green vegetables and leafy vegetables all are rich in folic acids. Now comes the role of vitamin D in our diabetes. Vitamin D is such a nice vitamin which is basically produced in our body while we expose ourselves to the sunlight. If we do not get enough vitamin D, this can lead to the pathogenesis and the aggravation of the complications of diabetes and many other diseases. We can see that vitamin D deficiency induces the regulation of interleukins and some cytokines in our body. This can cause the oxidative stress in our body along with some inflammation that can lead to the insulin resistance or the destruction of the beta cells. So in this way, vitamin D deficiency can induce the pathogenesis of both type 2 diabetes and type 1 diabetes respectively, and it can aggravate the situation or it can make the situation worse. We can see the prevalence of vitamin D deficiency all over the world. And if we concentrate on India, the map is worse. It falls under the red category where most of the populations are deficient in vitamin D. In current scenario, for the past 2 years, we are locked down in our home and staying mm, indoors. So we are not getting exposed enough to produce the vitamin D. It is getting the worse. It is making the situation worse that vitamin D deficiency is very, very common nowadays. The best source of vitamin D is sunlight. When we get exposed in the sunlight from 10 a.m. to 3 p.m., we get enough vitamin D synthesized in our skin. That is converted in liver and then in kidney, and we get the active form of vitamin D in our body ready-made. There are also some food source of vitamin D which includes egg yolk, sardine, tuna, some fish oils and fish, etc. So we can conclude that Vitamins are very, very essential for a normal person, but there are increased need of vitamins for a diabetic patient. So checking regularly the vitamin levels in the body and maintaining by supplementation if needed is very, very important for diabetic patients to maintain a healthy life. Here are some references I have used to make this PPT. So you can go through these references for further readings, and further research studies are to be published. Thank you very much, ma'am.
Thank you, Suparna. Thank you, Suparna, for the lovely presentation. And
Thank you.
we can seriously see that there is a link between vitamins, micronutrients, and diabetes. So there is these micronutrients could make a person more prone to diabetic if they are not consumed in a proper way. And we can, from your presentation, we can make out that these supplementation would even, the supplementation of these micronutrients would even help the patient with diabetic in a long run so that they don't land up in diabetic complications.
Like diabetic neuropathy is a very common thing in vitamin B12 and folic acid deficiency. The homocysteine is getting dumped in our blood, and then in the nerves, and peripheral nerves get injured in that way. So vitamin B12 supplementation helps very, very good way to prevent the older persons mostly from the vitamin B12 deficiency, which is very common in our country.
Yeah, absolutely right. Absolutely. I would request if there are any other questions for Suparna, we can ask her.
Should I turn off the screen sharing now?
Yeah, you can.
Okay, thank you.
Can we move on to the second session?
Yes.
Has Soma ma'am joined us?
Yes, just now she has joined.
Yes, I have joined.
Good evening, ma'am. Our second talk of the day will be done by our senior dietitian, Mrs. Soma Mondal. She is working as a senior dietitian at Ramkrishan Seva Pratishthan. She has a work experience of 24 years in this field. She is a BSc in zoology from Calcutta University. She even has a BA degree from Calcutta University. She has completed her MSc from IGNOU. She is a postgraduate diploma in nutrition from All India Institute of Health and Hygiene. She is a certified diabetic educator from WHO. She is a junior research fellowship from International College of Nutrition, Muradabad. She was a former faculty at Nursing College at Ramkrishan Mission Seva Pratishthan. She is also associated with Raja Narendra Khan Women's College. Recently, her work on type 1 diabetes was published in JAPI. Ma'am would be talking about weight management in diabetes. Being overweight or underweight, both are harmful for our health. We have seen from the data that even a slight reduction in the weight could improve the percentage of diabetic complications by 13 to 15%. So I welcome ma'am on board and I request you to share your knowledge with all of us. Welcome, ma'am. I hand over the session to you.
Good evening, Apurna. Good evening, Kajol, and good evening to all of you. Let's start with the weight management in diabetes. I just try to share my PPT. Aparna, is it visible?
Yes, ma'am, it is visible.
Okay. Okay. Today I have a topic regarding the weight management in diabetes. Let's start with the how to manage the weight in diabetes. First is type 2 DM is most common. That is the non-insulin dependent diabetes mellitus is the most common, and it is due to the unhealthy lifestyle and obesity. Prevalence of diabetes is increasing worldwide. India has been reported a maximum increase since the last few years. Among the diabetic patient, that those who are discovered as a diabetes, 90% of them are suffering from the non-insulin dependent diabetes mellitus. So we have to emphasize on the type 2 DM and the weight reduction for the type 2 diabetes mellitus. Next slide is what is the relation between the type 2 DM and the obesity. There is a strong relation between the type 2 DM and the obesity. Let's start with the what is the relation. Type 2 DM occurs due to the insulin resistance. What is insulin resistance? Insulin resistance is a condition when the body does not respond as well to the insulin. That means insulin is produced, but glucose is not able to enter into the cell due to the excess accumulation of the fat. So obesity is characterized by the enlargement of the adipose tissue all over the body. The obesity increases day by day, and obesity means the accumulation of the fat, and accumulation of the fat that induces the risk of the insulin resistance and the type 2 DM. Actually, the gene expression of the pro-inflammatory cytokines is higher in a visceral fat. Actually, fat has two type of obesity. Actually, this fat, there are two kinds of fat. One is the visceral fat and another is the subcutaneous fat. The gene expression for the pro-inflammatory cytokines is higher in visceral fat than compared to the subcutaneous fat. The cytokines interfere the function of the insulin receptor, and that cause to the type 2 DM. Excess amount of fat lead to the non-insulin dependent diabetes mellitus. Let's start with the causes of obesity. As we all know that the cause is the lack of physical activity and the excess calorie intake. Nowadays, most of we are sit in the home, and we are working in sedentary and work on the online mode. So it leads to the obesity, which is in turn leads to type 2 diabetes mellitus. Eating behavior, that is eating in front of the TV, and the excessive stress is also leads to the diabetes mellitus. Too little sleep is also a causative factor, because now our sleep cycle has now changed, because due to busy work schedules we stay awake at night, and we are hungry at that time, so we take some sweets or the chocolate at that time. That will increase the obesity. Hereditary is also the factor. Hypothyroidism is also the another factor, and certain drugs like the corticosteroid, if the patient is taking the corticosteroid, and the epileptic drug and antihistaminic drugs, that is also induce the type obesity, which is also in turns the type 2 DM. Complications of the obesity. There are so many complications of obesity. First complications is the type 2 diabetes mellitus, high pressure, stroke, high pressure that leads to stroke, different kinds of heart disease, dyslipidemia, gallbladder disease, osteoarthritis, and sleep apnea. Sleep apnea is a kind of disorder that this type of disorder. In this type of disorder, breathing repeatedly stops and starts. So sleep apnea is a major cause of the type obesity, and it leads to the diabetes mellitus. Other metabolic syndrome is also the complications of obesity, and cancer and depression, PCOS, that is the polycystic ovarian disease, is also a causative factor of obesity. We all aware about the PCOS, that is the polycystic ovarian disease. Next is the assessment of obesity. How we assess the obesity. Obesity is assessed by the body mass index and the waist hip ratio. Body mass index, as we know, that is the normal body mass index is for the Asian is 18.5 to 22.9, and for the overweight it is 23 to 24.9, and in obesity it is greater than 25. And waist hip ratio is the another tool. It is used to detect the central obesity of an adult and its association with the different kinds of health risks. It is an excellent marker for the adiposity. In case of the men, the waist hip ratio must be within 0.9, and in case of women, the waist hip ratio within 0.8. So we have to maintain the waist hip ratio, and we have to maintain the BMI to reduce the obesity. Next part is the management of obesity. It is a very important part. How we manage the weight, how we manage the obesity. This is the balance. First thing is we have to do, that is the balanced energy restricted diet. Balanced energy restricted diet means the total amount of calorie is restricted. That means the calorie restriction is differ from person to person, and it is also depend on the height, weight, age, sex, and the activity of the person. So calorie is individualized. So diet chart is always individualized, and the amount of carbohydrate requirement is 50 to 55% of the total calories should be from the carbohydrate, and among this, the 40 to 50% is coming from the complex carbohydrate, and rest is coming from the simple one. And protein intake, what about the protein intake? Is not too much of the protein intake. Protein should be within 15 to 20% of the total calories to prevent obesity, and fat should be limited up to 30% of the total kilocalories. Next is fiber. Always to talk about the fiber intake. So high fiber intake appears to reduce the amount of insulin needed because it lowers the blood glucose level. It appears not only to lower the blood glucose level, it also appears to reduce the dyslipidemia, that is the cholesterol level, as well as the triglyceride level. Recommended intake is the 25 to 35 grams of fiber per day to reduce the blood glucose level. And it also improve the weight management. So you have to give the 25 to 30 grams of fiber per day, and it is also given in different menu. That is in morning breakfast, after that it is to lunch, and after in the snacks, if it is possible, some kind of fiber you have to add, and in the dinner or before dinner you have to add some kind of fiber. But the whole day's intake should be within 25 to 35 grams of fiber to reduce the blood glucose level and to reduce the obesity. Next weight management program is the eating pattern and the portion control. Always we say about the portion control. Portion control is very much necessary to reduce the obesity. The portion control means total calories should be distributed throughout the day, and the consumption of breakfast is must. That means you have to take the breakfast must. You have to take the breakfast, and the others meal, that is the small others meal, you have to take. That means not the skip of the milk is not recommended. You have to take the small meal in regular interval, but breakfast is must. Consumption of the greater energy intake during the day may be preferable than the night. And portion control at meal and snacks result in the reduction of the energy intake, as well as it is helpful for the loss of weight also. Portion control should induce the reduction of the obesity also. So first is the energy restricted diet, and the second thing is the portion control. It is very much helpful for the reduction of the weight, which in turn help in the reduction of the non-insulin dependent diabetes mellitus, that is the type 2 DL. Third thing is the meal replacement. First of all, what is meal replacement? It is, if these, before we are talking these two, that is the energy restricted diet and the portion control, if both are not too helpful, then we are advised for the meal replacement. Meal replacement is a drink or bar or a solid food with a controlled calories and the nutrient. It is given to the patient. It is given according to the guideline. Everywhere we follow the guideline. So in case of the meal replacement, we have to follow the guideline, that is the ADA guideline, American Diabetic Association guideline. According to the ADA guideline, meal replacement can be used to treat the diabetes, to maintaining the weight loss. It is started to replace the different kinds of products. It is started with the different kinds of product that is restricted in calorie, and meal replacement product, it can be used once or twice per day for the reduction of the weight. Regular meals to maintain the weight loss, as well as the which is also help to read for the reduction of the non-insulin dependent diabetes also. So meal replacement, what are the meal replacement thing? That it may be liquid meals, it may be meal bars, it may be solid food also. It is an alternative meal that we can provide to the patient, those who are failure to maintain their weight. So we are given at that stage, we are giving the meal replacement for 1 or 2 times per day for a limited period of time. And the next thing is the low glycemic index diet. What is low glycemic index diet? That is the high carbohydrate diet. That means the whose glycemic index is above 70, such as the potato, bread, and the low-fat cereal product. It is digested and absorbed very rapidly, resulting in the high glycemic load as well as the high glycemic index increase, and it needs the more insulin for the digestion. So in insulin resistant person, that is those who are obese, they are the insulin resistance. They consume the high glycemic, if they consume the high glycemic index food, the postprandial glycemia, hyperglycemia, and the insulinemia are magnified. That means that is going high, possibly contributed to the cell exhaustion, and it also developed the type 2 diabetes. So we prescribe the low glycemic index food. Low glycemic index means the high fiber containing food. The foods that is containing the high fiber, that is the all kinds of vegetables and the citrus fruits, both are the low glycemic index foods that should be prescribed for the weight loss program. And weight loss program, and it is also helpful for reduction of the postprandial blood glucose, and which is in turn responsible for the reduction of the obesity. And low glycemic index food may benefit the weight control in two ways. First, it promotes the satiety. That means the patient is not feeling hungry. And secondly, by promoting the fat oxidation at the expense of the carbohydrate oxidation. That means if carbohydrate is restricted, then the fat is oxidized. And moreover, low glycemic index, high fiber food will gives the satiety of the patient. So it is very much helpful. Low GI food is very much helpful for the obese as well as the type 2 diabetic patient. Now we come to the end. That is the summary. What is the summary is that medical nutrition therapy is the major key, that is it is the key factor for the obesity management. And obesity is now the rising concern globally. uh, Globally, not only the globally, it is also a rising factor in India. Most person needs the sustained and the long term lifestyle intervention. That means obesity, if the patient is 20 to 40 10 to 20 kgs weight, they 10 to 20 kgs overweight, that means that 10 to 20 kgs is not reduced by 1 month. So it is a long term program. So long term lifestyle intervention is very much necessary to reduction of the obesity, as well as which is in turn helpful for the type 2 DM also. So intervention is the major factor, and it should be done by the qualified dietitian and experienced dietitian. So the nutrition therapy is the prime importance, and hence it should start with the MNT, which will help the patient in achieving the weight management of the diabetic patient and for the reduction of the obesity also. Thanks to all of you. Thank you, Aparna.
Thank you, ma'am. Thank you, ma'am, for a nice and a summarized way in explaining the relationship between obesity and diabetes. As ma'am was talking about, not only the calorie restriction, we need to focus on portion size as well as the pattern in which you eat. And once you start taking more fiber, then the micronutrient deficiencies which Suparna was talking, which can affect diabetic people, will also be managed in a way. So there is a relationship between micronutrient deficiency, obesity, diabetes. So basically, we have to be careful about weight management, lifestyle interventions, so that we can lead a healthy life and prevent us from all the diabetic complications, and especially for the burden which the world is facing, where the people are undiagnosed about diabetes and they are at a risk of developing diabetic complications because they don't even know that they are borderline diabetic, and it can lead to complications in future life. Thank you so much, Soma ma'am, for your enriching session.
Thank you, Aparna. Thanks a lot.
I would request if anyone has any other question, we can ask Suparna and Soma ma'am. They are here to help us. I don't think, ma'am, it was very well explained, so there are no more questions in the chat box. So thank you so much, everyone, for the patient hearing. And I request you and Soma, I thank on behalf of Day for taking out your time and sharing your knowledge with us. Thank you so much, ma'am. And it was a nice session, and it would really help our participants to deal with diabetic patients in future. Thank you so much. Thank you, everyone. Can we end the meeting?
Thank you, Di. Thank you very much.
Thank you.
No question. Till now, Aparna, there is no question.
No, ma'am, there are no questions, neither in the chat box nor in the Facebook Live. Okay, but ma'am, we can just discuss. It is important to talk about the 9-inch plate to the patients and tell them the importance, the way they should eat. They should start their meal with a fiber-rich salad and then move on to the protein intake initially, and then move on to the carb, so that the carb intake is reduced if they're consuming at the end of the meal. So this is the way we can help the patient in controlling their diabetes, controlling their weight.
Yes, eh, absolutely. Absolutely, absolutely true. Aparna, what you are telling, that is absolutely true. Because
Yes.
if you enrich, if you add more fiber, that will give the satiety, which in
Yes, ma'am.
turn reduces the obesity also.
But ma'am, people these days are into the habit of taking meal replacements. But even
Yes,
if they're
that's
taking
why
meal
I am
replacement,
actually ADA is telling about the meal replacement when the calorie restriction is not applicable, not is going to কি বলবো যতক্ষণ ঠিকঠাক মতন কাজ করছে না তো for the certain period of time the patient is taking the energy restricted diet, but if
yeah,
it is not working truly, then
yes, ma'am.
ADA's guideline is telling that you are going for the meal replacement. Meal replacement means nothing. That means you are restricting the calorie intake and increases the fiber intake in the form of liquid or in the form of bar or in the form of solid food. You can add the solid food instead of the any kind of other মানে কি বলবো যেগুলো বাইরে পাওয়া যায় সেরকম টাইপেরই মিল রিপ্লেসমেন্ট খেতে হবে তারই কোনো মানে নেই। You can মানে you can make their own meal replacement.
Yes, ma'am, but
Instead of
they
the
should
what
be
is
done
available in the
under
market.
the supervision of a proper qualified dietitian.
Yes,
Because unless and until,
that I have stayed exactly. Unless it is a কি বলবো, unless it is not fruitful, if
yes,
it is
ma'am.
not done by the, if it is the intervention always should be done by the qualified dietitian. If it is not done, how it is helpful?
Yes,
Always
ma'am.
whenever you are talking, but whenever you are we are giving our child for the qualified teacher. What is the utility of the qualified teacher? Qualified teacher will teach you in a right way. That means the qualified dietitian will also teach you the in a right way. The meal replacement also they are taking in a right manner. What the ADA guideline is, that is the one time meal replacement, all the 2-time meal replacement. That means you
Yes,
are
ma'am.
not taking the another bar or this type of thing, but you can take the meal replacement instead of your full meal. That you have
Yes, absolutely
that you
right,
have
ma'am.
to take. But
Absolutely,
everything is
man. And we should,
everything is followed by a true guideline, and it is done by the qualified dietitian also.
yes, for a better result, they should always be supervised by someone who is qualified more than the Google, so that they don't go and search on Google and do it on their own. So that is the keynote, that it should be supervised by someone who is qualified, and then you should go ahead in managing your body, healthy body.
Yes. Yes, that I have to told that you are not going to the meal replacement. That means you are not going to the shop and take the meal replacer. I mean, just you have to dissolve it and take it. That is not,
Yes, ma'am.
that is not give you the right. That is not give you the in a right path. You have to guide it by a qualified dietitian who will formulating the diet. If it is not helpful, then you go to the portion control. If the portion control is not at all helpful, then after that you can go for the meal replacement. First thing is not meal replacement. First thing is the energy restricted diet. And after that, if it is a failure, then you go for the proper portion control. And the walking is very much important. For that is the physical activity for the weight reduction. Unless and until you are physically active, how you can reduce your visceral fat, because the visceral
Yes, ma'am.
fat is very much important. So for the reduction of the visceral fat, you have to go for the walk, you have to go for the activity, because activity is the first concern. And after that, if everything is not going fruitfully, then you go for the one-time meal replacement and or 1 or 2-time meal replacement.
Yes.
That is the guideline, what I am telling. I
Yes,
also
ma'am.
read from the ADA guideline. So guideline
Yes,
is,
sure.
that's why I am telling. So I
Yes,
also
sure, ma'am.
educated by the ADA guideline. Is it true, Aparna?
Yes, ma'am.
Yes.
Absolutely. Absolutely, ma'am.
Okay.
Thank you. Thank you so much, ma'am, for your help and for the
Aparna, there
session.
are a few questions on the Facebook.
Ma'am, there is a question. Is soluble fiber more effective in type 2 diabetes?
Soluble fiber is more effective than in a type 2 diabetes because soluble fiber will not only reduces the satiety, it also helpful for the reduction of the cholesterol, and it also helpful for the reduction of the triglyceride level, and above all satiety is concerned, and it all in all respects soluble fiber is very very helpful, and it also relieves the constipation also.
Okay. Thank you so
Then
much, ma'am.
the
Ma'am, there
it
is
is very
another question.
yes.
There is another question which can be taken by you or by Suparna. So they're asking that
Yes.
explain the method of measurement of BMI.
Suparna will tell what is the
Suparna, can
measure,
you
how
take this question?
how to measure the BMI.
Sure, ma'am. Sure, ma'am. For measurement of BMI, we need two another anthropometric measurements. One is the person's height in centimeter, and another one is the person's weight in kg. Then we calculate the BMI in the unit kg per meter square. So if a person is 162 centimeter high and the weight of the person is suppose 70 kg, then we measure the BMI by dividing 70 with a multiplication of 1.62 into 1.62. Then we get the BMI in kg per meter square unit.
Yeah, this is the way to measure the BMI. And we should be very particular while taking the height that it is taken on a flat surface. The patient is standing absolutely upright, and there is no error in the
And the
measurement of
face,
the height.
the eyes should be on the vertical plane.
Vertical frame. Yeah, that is the way.
Actually, the
Thank you,
term is called
Suparna.
orthostatic position.
Yes, yes,
thank you.
actually. Yeah. Thank you, Suparna. Thank you for the nice answer.
Yes.
Thank you.
Let
you,
me
ma'am.
check if there are any other questions. Ma'am, there is a question. Is there any guideline when to give 1 meal replacement, or we should go in for 2 meal replacement? Is there any guideline?
Again, I am talking for this ADA guideline that the American Diabetic Association guideline is that for the meal replacement, American Diabetic Association guideline for the meal replacement, that meal replacement can be used to treat the diabetes to maintaining the weight loss. It is also stated that replacement product can be used once a time. First, you have to try for the one time, or you can also try for the twice a day in lieu of the regular meal. Whenever you are taking the meal replacement, you have to replace your regular meal for that time whenever you are taking the meal replacement. So in lieu of that, you can take the one-time meal replacement or the two-time meal replacement to maintain the weight as well as to maintain the non-insulin dependent diabetes mellitus. But this is not the prime treatment. First treatment is the balanced and the energy restricted diet and the portion control. And if it is not working fruitfully, then you have to go for the meal replacement. This is my suggestion, and I have to telling the guideline, that is the ADA guideline.
Yes, ma'am, absolutely right. I think the people are clear then when you should go in for meal replacement and in what manner. If you are not able to lose weight, and people generally reach a plateau when they have lost few kgs and they reach a plateau, that time you can go in for meal replacement when you are not able to lose further weight, and the weight reduction would help you in managing your diabetes. That time under the supervision you should go in for 1 meal replacement or 2 meal replacement. Thank you so much. Thank you, ma'am.
Any other question?
I don't think so, ma'am, but we have a lot of comments that excellent session by you and Suparna. So thank you both of you for the excellent session and
Thanks
thank
to
both of you
thanks
on
to
behalf
you,
of
thanks
Day.
to Kajol, thanks to Day for this type of platform for the awareness to the public also.
Yes,
And
sure.
thanks to
Thank you for
Aparna
Day,
for
and thank you
for
all.
his such a moderator. You like such a moderator because our moderator is also a dietitian. This is
Thank you
also
so much, ma'am.
because our moderator is also a qualified dietitian, and who is also
Thank you so
hosting.
much, ma'am.
Kajol is also a dietitian. So it is our
Yes,
totally dietitian platform. So we are very
platform
proud
to
of that
discuss. Yes, ma'am.
because we are discussing the diabetes with the dietitian. Okay.
Sure,
Yes,
ma'am. It was a nice platform for discussion. Thank you so much.
Thank you all. Very nice session.
Thank you.
Thank you, ma'am.
Thank you. Very
I
nice.
want to see the Kalpanadi. I want to see the Kalpanadi in this
দেখতে চাই আবার দেখো
because
কথা বলবো।
whenever
হ্যালো
Hello, ma'am.
Hello, ma'am.
হ্যালো 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 হ্যালো
Thank you, everyone, for
Thank
your
you.
support and guidance.
Thank you
And
all.
thank you for the support of
any
our
message
president.
from the Kalpanadi because the senior one is the Mrs. Kalpana Roy. So any message is coming from the Kalpana Roy?
You have explained everything very nicely. You and Suparna also. Suparna is too junior, but she has also explained very nicely. So I think from my part, there is nothing to explain again because Aparna also added some points. So I'm very glad to see you all and listen your all explanation. Thank you all.
Thank you, ma'am.
you,
Thank
ma'am.
you for your support and guidance. And we have
Thank
seen
you.
that with the support of our president, Dr. Basu, and our secretary, Mr. Indrajit Majumdar, and all our senior dietitians, doctors, and educators who are a part of Day, we would like to bring some change in the society so that the way they are managing this non-communicable disease, diabetes. Thank you for the lovely session.
Thank you,
And
Kajol and Sukarna also from back.
Yes, thank you, Suparna also.
Sukarna and Kajol from back.
thank you, everyone. I think we are ending the session. Thanks a lot and good night to all.
And